Postpartum depression. Why you should know the symptoms and statistics. As many as 1 in 7 people who give birth will experience postpartum depression. It's more than just feeling blue after having a baby. It's a form of clinical depression that usually requires professional support and treatment. Understanding this condition can help you recognize it, if it ever affects you or your loved ones. And reading up on statistics about it can help decrease the stigma about seeking treatment. What is postpartum depression? People with postpartum depression, PPD, usually present with intense anxiety, possibly postpartum anxiety, sadness, or even despair that make it difficult or impossible for them to function normally after bringing their new baby home. These feelings usually last longer than the baby blues, which tend to resolve within 2 weeks. Symptoms of postpartum depression. Symptoms of PPD vary, as can the duration and intensity. However, when any of the symptoms listed below persist for more than 2 weeks, when normal functioning is affected, or if there are suicidal thoughts, seeking help is vital. Some of the symptoms can include feeling sad, hopeless, or overwhelmed, feeling guilty or worthless, becoming easily fatigued or irritable, crying easily and often, withdrawing from family and friends, eating too much or refusing to eat, sleeping too much or having trouble sleeping, losing interest in activities previously enjoyed, experiencing memory problems or difficulty making decisions, neglecting the baby. It's also important to note that PPD can affect anyone who has recently welcomed a baby into their life, regardless of gender. This includes partners of the person who gave birth, as well as adoptive parents. Key statistics about postpartum depression. One factor to keep in mind before examining statistics about this condition is that many cases go unreported, so numbers are likely even higher in reality. There's significant stigma around PPD, so parents or caregivers who experience it may be hesitant to tell their feelings with anyone, much less seek treatment. The reason for this is usually that people don't want others to view them as bad parents. That's why it's important to remember and talk about how postpartum depression is a clinical disorder that has nothing to do with one's ability to be a good caregiver, and that those experiencing it deserve support, care, and get treatment. Here are some key facts and statistics to know. Postpartum depression is common. According to an article on the Johns Hopkins Medicine website, as many as 85% of women will experience mood disturbances after delivery. 1 in 7 may experience postpartum depression, and 10 to 15% may experience severe postpartum depression. When it comes to adoptive parents, some research has shown that rates for PPD among this population may be similar to rates among biological parents. Symptoms can start early. According to the American Psychological Association, APA, about half of women who end up receiving a postpartum depression diagnosis experience symptoms during their pregnancy. Treatment is effective, but many don't seek it. According to the CDC, over half of pregnant people with depression do not receive treatment. One obstacle may be that awareness about the realities and likelihood of PPD is low. This can lead those experiencing symptoms to chalk them up to sadness or nervousness about parenthood and not seek treatment. Treatment for PPD. Postpartum depression is a serious condition, and those affected by it should get appropriate help as soon as possible. Therapy is a common treatment option. Either cognitive behavioral therapy, CBT, or interpersonal therapy may be used by the treatment provider, since both have been shown to be effective for PPD. Why treatment for PPD is important. Postpartum depression can have negative consequences for the parent experiencing it, as well as for their partner, or other loved ones and their child. As a 2019 study puts it, the results suggest that postpartum depression creates an environment that is not conducive to the personal development of mothers or the optimal development of a child. It therefore seems important to detect and treat depression during the postnatal period as early as possible to avoid harmful consequences.